The mental incisive nerve block is indicated for pain management in the mandible anterior to the mental foramen. The clinician can utilize radiographs and palpation to identify the mental foramen. It is best to retract to be able to visualize the area between the two premolars. The insertion site will be at the depth of the mucobuccal fold, at approximately 20 degrees to the long axis of the root. It is important to keep the retraction thumb well out of the way. There are two options, both vertical, demonstrated first in the video, and horizontal, demonstrated second. The deposit site will still remain slightly superior to the mental foramen. The difference will be seating position. For a 12 o'clock vertical position, the clinician can utilize their thumb to retract the tissue downward and outward, utilizing the rest of the fingers of the hand to support the chin. You need to confirm that you have good visualization to the depth of the vestibule. You will loosen the cap, achieve stability, and visualize your penetration location at the depth of the vestibule. The target site is slightly superior to the mental foramen. It is possible to use extraoral options for stability, like the patient's goggles, as demonstrated in the video. The mental incisive is a combination nerve block. If a clinician only gave a mental, it would anesthetize the buccal soft tissue of the premolars through the central incisors, the lower lip and chin, and possibly the tooth at the deposit site. If a 1-minute massage is administered, the incisive is included. This will anesthetize the pulpal of the premolars through the midline, as well as the buccal soft tissue and the chin and lip. Extended verbals for the mental incisive nerve block. The medical history has been reviewed and the vitals are stable. No contraindications for local anesthesia. 20% benzocaine topical will be used for 1 to 2 minutes. 3% mepivacaine plain with an expiration date of 11/2018 and a 27 gauge short needle. This injection is the mental incisive nerve block. It will anesthetize the pulpal of the second premolar through the midline and the buccal soft tissue of the affected teeth with a 1-minute massage. The insertion site is the depth of the mucobuccal fold superior to the mental foramen. The depth of penetration is approximately 3 to 6 millimeters. The deposit site is slightly superior to the mental foramen. Landmarks are the mental foramen and the depth of the vestibule. The pathway includes 20 degrees to the long axis of the root. Bone contact is suggested with a 1 millimeter retraction before deposit. The dose is 0.6 milliliters. Complications are edema, pain at the site, and possibly hematoma. During the injection, it is important to communicate with patients and faculty. Give the patients positive feedback. With the faculty, state when you have reached your landmark. Also state that you are aspirating and the results of your aspiration twice. Note when you are ready to deposit your solution.